What is a gastric bypass? A gastric bypass was the most popular bariatric surgery these last years before the arriving of the gastric sleeve. We started to do bypass in the 60s, but at that time I opened surgery and laparoscopically started to learn around 20 years ago. It's a very good procedure, especially for obese patients with metabolic syndrome, type 2 diabetes, high cholesterol, high blood pressure, and when they have a severe acid reflux without hiatus hernia. For that patient, definitely gastric bypass, the other name is one-way gastric bypass, is better than a gastric sleeve. With 4 to 5 small holes, I will perform this surgery in 45 minutes, 1 hour, and we'll do a small gastric pouch connected to the small bowel, and this pouch will bypass, the name of the bypass is coming from that, will bypass the rest of the stomach and the beginning of the small bowel. With this technique, which is very effective, you will lose a lot of weight, around 10% of your current weight the first month, and then gradually in 9 months, 12 months, you will go to your nadir point. We need to do before an assessment to check all your parameters, blood work, upper endoscopy, you need to see a dietitian, a psychiatrist or psychologist, and then if everything is clear, we can go to surgery. In terms of side effect, it's possible to have some dumping syndrome, sometimes some intestinal pain. The few risks when you have an experienced team at the beginning, yes, like all surgery with a stapler, you can have a leak, but it's very rare. You can have an intestinal obstruction, even long time after the surgery. So at the end, it will be a complete change for you. You will lose a lot of weight, but to keep that sustainable, you need to adopt a different lifestyle. After 1 month, you need to do a lot of sport if possible, and you have to avoid fizzy drinks, carbs, and fatty food. Now, it's the beginning of a new life.